Now, as far as the stiffness is concerned, as far as the movement of the arm is concerned, it is not going to be hampered because of this malunion. It will only appear as a bump. As far as functional activities are concerned, it will be absolutely normal. Point number 2, that what is the name of the classification? What is just the name of the classification for the fracture of the clavicle? It is classified by Allman classification. Alright, so fractures of the clavicles are classified by Allman classification. So you need not to go into the details of these clavicular fractures too much. All you need to have a discussion on is that how these clavicular fractures are managed, what are the unique points related to the clavicular fracture, and what are the complications. As far as the complications are concerned, there are numerous other complications, like it can lead to neurovascular injury, it will lead to a bump which will appear, alright. Related to the fixation, it can result in infections also. But all these complications are something which you need not to recall again and again. What you have to remember related to the complication is the malunion. That malunion is the most common complication which is likely to happen. Now, read out this question, that all of the following are the components of the floating shoulder except, so what as a topic we are about to discuss is the floating shoulder. The floating shoulder has got 3 components. One is there is a complete fracture of the clavicle. 2, that there is a complete fracture of the glenoid. Now, glenoid is a part of the scapular bone. So, there is a complete fracture of the glenoid, because in your options, instead of specifically marking the word glenoid, they can give you fractures of the scapula also. And the third one is associated soft tissue injury. Now, those soft tissues are going to be like, there could be a presence of acromioclavicular ligament, coracoacromial ligament, the glenohumeral ligament. All these ligaments could be disrupted. So, it will lead to a floating shoulder. Now, what are the components? If you look back to the question, that all of the following are the components of the floating shoulder except, complete fracture of the clavicle is a component of the floating shoulder. Fracture of the glenoid is a component of the floating shoulder. But fracture neck of humerus, humerus is nowhere given that it should be fractured so as to call it as a floating shoulder. Alright, so fracture neck of humerus is not the correct answer in this particular question. And yes, associated ligament injuries are always going to be there. If you look at this picture, so this is the picture of a floating shoulder. Like there is a complete fracture of the clavicle, there is a complete fracture of the glenoid also, but the humerus is absolutely normal. Now, why is it called by the name of a floating shoulder? Because, the entire assembly of the shoulder joint is associated to the axial skeleton, is connected to the axial skeleton through this clavicle and the scapula. Now, if there is a breakdown of the clavicle, if there is a breakdown of the scapula, then this entire assembly will no more be connected to the central or the axial skeleton. That is the reason why it is called by the name of floating shoulder. So, hope you have understood everything related to the floating shoulder. We are expecting this topic with this question to be kept in your examination in the near future. Now, next, before we talk about the next topic, it is important to have a discussion on the most commonly asked question related to this particular topic. Now, what is the name of the nerve which is likely to get injured when you are provided with this kind of the X-ray? So, all you have to identify is that what is the name of the bone which is injured? What is the name of the bone which is fractured? So, if you look at this bone, the name of the bone is humerus and it is having a fracture of the humerus in the proximal part. So, what we are talking about is the fractures of the proximal humerus. So, the heading is fractures of proximal humerus. Now, it is again not very difficult to have a discussion or understanding of that fractures in the proximal humerus will be because of the same mechanism, that is fall on outstretched or fall on abducted and externally rotated arm, that will result in the buttressing of the head of the humerus against the glenoid, which will result in the breakdown of this bone. That is point number 1. So, the mechanism remains the same, that is fall on outstretched arm. Alright. Now, point number 2, that is the mechanism. Now, point number 2 is that what is the name of classification? The name of classification for this proximal humerus fracture is the Neer classification, NEER. Now, Neer has classified the fractures of the humerus into numerous types, multiple types. But what you have to remember is that what is the Neer criteria for displacement? The Neer criteria for displacement is, that if there is a displacement That means if there is a separation of 2 or more than 2 centimeters, 1 or more than 1 centimeter in between the fragments. If any of the fragment of the humerus is separated by more than 1 centimeter, it is said to be a displaced fracture. And second is that if there is an angulation of more than or equal to 45 degrees. Imagine if this is the proximal part of the humerus, this is the normal proximal part of the humerus, and here we are having a fracture. Now because of this fracture, what is happening? That there is a separation in between the two fragments. Now if the angle which is created in between the two fragments is more than 45 degrees, it is said to be a displaced fracture. And second, if the distance in between these two fragments is greater than or equal to 1 centimeter, then it is said to be a displaced fracture. Alright. So this is what you need to remember in Neer criteria for displacement. As far as Neer classification, which is categorizing the fracture into 4 types, is concerned, that's Neer type 1, it is 2-part fracture. Neer type 2 is 3-part fractures. Likewise, Neer type 4 ultimately is a comminuted fracture. So no one is going to ask you about the Neer classification. What is interesting, which could be kept in your examination, is what is the criteria. Then third one is obviously the complications. Now as far as complications are concerned, and a complication which will always happen in case the proximal humerus is fractured, one of the complication is stiffness. Now stiffness is considered to be the most common complication. Apart from this, another complication is the malunion at the fracture site. Imagine if there is a fracture and it was not adequately fixed, it was managed conservatively by the application of the long U slab, then in that case malunion is considered to be the most common complication. And the third one is the nerve injury. Now the nerve which is likely to get injured because of the proximal humerus fracture is the axillary nerve. So the nerve which is likely to get injured is the axillary nerve. Now if you go back to the question related to the proximal humerus fracture, now what you see over here is that there is a fracture of the bone in the proximal part of the humerus. What is the name of the nerve which is likely to get injured? Is the axillary nerve. So it is not very difficult. All you have to do is identify the bone, because once you have identified the bone or the joint, then axillary will be the obvious answer for that particular question. Now next is, what is the name of the nerve which is likely to get injured when you are having a fracture of the mid 1/3 of the humerus? Now before we go with the fracture of the mid 1/3 of the humerus, what we tend to see over here is that there is a managed proximal humerus fracture by putting a buttress plate. This is a locking plate in the proximal aspect of the humerus and it is managed by surgical means. Alright. Now what you tend to see over here, what is the name of the nerve which is likely to get injured in case where there is a mid 1/3 shaft of the humerus fracture? Now all of you are aware of the fact that if this is a bone, that is humerus, and this is the medial aspect of the humerus, this is the lateral aspect of the humerus, and the name of the nerve which is traversing or lying in closed approximation with this bone is the radial nerve. Now the nerve, initially it crosses the medial aspect, then it descends down, and then through this spiral groove it comes to lie laterally and then it descend down. So along the long axis of the humerus, the nerve is lying in closed approximation. Now imagine if there is a fracture in the region of the mid 1/3 of the humerus, then the name of the nerve which is likely to get impinged, likely to get compressed, is the radial nerve. So for obvious reason, for this particular question, they are asking that what is the name of the nerve which is likely to get injured? Answer for this question is the radial nerve, because in this mid 1/3 of the humerus fracture, the name of the nerve which is likely to get impinged is the radial nerve. Now there is a eponymous fracture related to this topic, and that eponymous fracture is the Holster-Lewis fracture. Now under the heading of this Holster-Lewis fracture, what you have to remember, that it is the spiral fracture of mid 1/3 humerus. It is the spiral fracture of the mid 1/3 of the humerus associated with radial nerve injury. Alright. So it is a spiral fracture of the mid 1/3 of the humerus associated with the radial nerve injury. You know, a spiral fracture of the mid 1/3 of the humerus can happen without radial nerve injury. Alright. Similarly, oblique fracture of the mid 1/3 of the humerus can happen with radial nerve injury. But none of the case it is going to be called as Holster-Lewis. In order to mark it as Holster-Lewis fracture, what you have to remember is that it has to be a spiral fracture, point number 1. in the mid 1/3 of the humerus and it has to be associated with radial nerve injury. Then it will be called as Holster-Lewis fracture. So hope everything is clear related to this particular topic also. Alright. Next is, if you read the question, that all of the following are the components of the terrible elbow triad except. Now these are the kind of the questions which are extremely common or likely to be asked, because in our examination we are having 4 options and one of the option is going to be the answer for that particular question. Now if you read out the options are fracture of the radial head, then fracture of the coronoid process, then fracture of the olecranon, or the dislocation of the elbow. One of the component is not the part of the terrible triad of the elbow. Now before we talk about this question, what are the components of terrible triad? The heading is terrible triad of elbow. Alright. Now under this heading, what you have to remember, that there are 3 findings or there are 3 components. Obviously triad means 3 components. Alright. The first component is comminuted fracture of the radial head. Now if you look at this radial head, if you look at this picture, there has to be a comminuted fracture of the radial head. That means radial head is burst into multiple pieces. Then point number 2, that there is a fracture of the coronoid process. Fracture of the coronoid process of ulna. Alright. Now if you look at this picture again, so this is the coronoid process of the ulna and it is also fractured. So fracture of the coronoid process of the ulna. And the third one is posterolateral dislocation. Posterolateral dislocation of elbow. Alright. So these are the 3 components of comminuted fracture of the terrible elbow triad. Now if you look back at the components, that all of the following are the components of the terrible elbow triad except. So answer for this question, fracture of the radial head, yes it is a component. Fracture of the coronoid process is also a component, but fracture of the olecranon is not a component. So it obviously has to be the answer for this question, and dislocation of the elbow is also a component. So hope you have understood everything related to this. A one-liner sort of a question, that all of the following are the components of the terrible elbow triad. Now why is it considered to be a terrible elbow triad? Because it is having a poor functional outcome. Imagine if the patient is having the fractures of those points or those surfaces which are responsible for imparting the stability to the elbow joint. Even if you go with the fixation, then also you will be having a poor functional outcome. Alright. So this is the kind of a trauma where the patient is said to have the expectations of a poor functional outcome even after the surgical fixation of this particular disease. So hope everything is clear in relation to this also.